If you believe growing in size after 60 is impossible, you've been misled. Many men assume aging equals decline. But what if the truth is the opposite? That even now, your body is capable of real, measurable growth in one of the most personal and powerful ways. I'm Dr. James Ellison, board-certified urologist and professor of men's health with over 30 years of clinical experience. I've helped thousands of men, including many who thought it was too late, rediscover their performance, confidence, and yes, even improve their size. This isn't about gimmicks or hype. Everything I share is grounded in clinical research, peer-reviewed evidence, and proven practical strategies. Here's what you won't hear from most doctors. You don't need risky pills or surgery. Some of the most effective ways to support penile length and function after 60 are safe, natural, and surprisingly simple, yet they're often overlooked or ignored. In this video, I'll walk you through 7 science-backed methods to help increase penile length safely and effectively, all designed with the aging male body in mind. Whether you're dealing with post-retirement changes, health-related shrinkage, or just want to feel like yourself again, this is for you. And no, you're not chasing vanity. You're reclaiming vitality, dignity, and confidence. Method number 4 alone has changed lives, and it takes just 10 minutes a day, but don't skip ahead. Each of these 7 methods builds on the next, and if you miss even one, you might miss your best opportunity to grow, not just in size, but in self-worth. Before we dive into the 7 methods, make sure to hit the subscribe
button and turn on the bell icon. That way, you'll never miss another health tip made specifically for men over 60. If you find this information helpful, type 1 in the comments. If there's something you'd like to see improve, type 0. Your feedback helps me create better, more meaningful content just for you. Now that you know it's possible and that age is not a barrier, let's walk through the 7 scientifically proven methods that can help you increase penile length safely, naturally, and confidently starting today. 1. Penile Stretching Exercises Manual. Therapy. When I first began working with older male patients over 3 decades ago, I remember one man, 67 years old, quiet but determined, who looked me in the eye and asked, "Is it too late for me to grow?" He wasn't talking about ego or vanity. He was talking about reclaiming a part of himself that he felt had been slowly slipping away. Like many men in their 60s or 70s. He wasn't seeking miracles. He just wanted to feel whole again. This is where we started manual penile stretching. It may sound overly simple, but this method is one of the oldest and most accessible ways to stimulate growth. And yes, there is science behind it. At its core, penile stretching relies on a biological process called tissue remodeling. Just as your muscles respond to resistance training by growing stronger, and more defined penile tissues can respond to consistent, gentle stretching. By expanding, this happens through cellular mechanisms like cytokinesis, the same process used in limb lengthening procedures and dental expansions. The key is repetition, not force. Think of it like yoga for your most private muscle group. Calm, steady, and incredibly powerful over time. The technique itself is simple. Begin with a warm compress, a moist warm towel around the area for 5 minutes to increase blood flow and reduce the risk of strain. Then, using a firm but gentle grip just behind the head of the penis, stretch outward. And hold for 30 seconds. Repeat this motion in each direction, up, down, left, and right. Do this 2 to 3 times per direction, and you'll have a full session in under 10 minutes. It's not about tugging hard or overexerting yourself that can do more harm than good. It's about consistency.
Doing this every day with patience and respect for your body, most men begin noticing subtle changes in both length and flaccid fullness within 8 to 12 weeks. These aren't overnight results, but they are real and achievable at any age. Now you might be wondering if this is so effective. Why haven't more men heard of it? The answer is simple. It's not flashy. There's no device, no pill, nothing to sell, just a method that requires daily commitment. And that's exactly why it works, because it puts the power in your hands. Literally, over the years, I've seen men regain not just centimeters of length, but something far more important: self-respect and personal agency. One patient told me, "It gave me something to wake up for every morning, a way to take back control."
Still, while manual therapy is powerful on its own, many men want to know how to accelerate their results, how to take that next step toward measurable long-term gains. That's where the next method comes in, a tool that's been rigorously tested, medically cleared, and quietly changing lives across the country. It's not just stretching. It's stretching with science behind it, ready to learn about it. Let's move on. If you're still here and this journey is resonating with you, drop a 1 in the comments to let me know you're with me now. Let's keep going and dive into the next powerful step 2. Use of FDA-approved penile traction devices. I remember the first time I introduced a penile traction device to one of my older patients. He was 71, skeptical, and had tried everything from pills to supplements over the years with little to no success. But there was something in his voice that day, a hint of hope. Maybe he didn't want shortcuts. He wanted something real, something grounded in science, not marketing. So I showed him what medical literature had already confirmed, that penile traction therapy, when used correctly, could lead to measurable lasting gains even in men.
Well beyond their 60s, traction therapy isn't new. In fact, it's been used in orthopedic medicine for decades to lengthen limbs, correct deformities, and remodel soft tissue. So the same principles apply here. When consistent tension is applied over time, the body responds by generating new cells. This process, known as mechanotransduction, leads to gradual tissue elongation, safely, naturally, and without surgery. What makes penile traction devices stand out is their precision. Unlike manual stretching, these devices allow for controlled and sustained force, often adjustable depending on comfort, and progress. The modern FDA-cleared models are far more comfortable and discreet than they used to be. Many of my patients wear them under loose clothing at home during reading time, or even while walking around the house for best results. Most studies suggest wearing them for about 1 to 2 hours daily over a period of 3 to 6 months. What's important is not the intensity of the pull, but the consistency of the application. Now, I'll be honest, some men find the idea of wearing a device a bit awkward at first, but those who stick with it often report not only an increase in length, but a surprising boost in confidence, posture, and overall self-image. One patient called it his daily reminder that he hadn't given up on himself. That stuck with me, because that's what this is really about. Not just physical change, but the emotional renewal that comes from choosing to believe you still have control over your body. These results aren't just anecdotal. Clinical studies have shown average increases of 1 to 2 in stretched penile length when traction therapy is used consistently. And no, this isn't about turning back the clock for vanity. It's about feeling present in your own body again. For men who've seen changes from aging, surgery, or even emotional trauma, this tool offers a kind of quiet restoration that most treatments can't match. I always tell my patients, if you're willing to invest just a little time each day, your body is still capable of growth that doesn't expire when you turn 60 or even 80. Growth isn't just a young man's game, it's a human one. But traction therapy is just the beginning of what modern men's health has to offer. Some men ask me, what if I want to improve blood flow too? I want better performance, not just length. That's a great question, and the answer leads us to a cutting-edge therapy that's non-invasive, backed by science, and originally developed for something entirely different. What happened next was one of the most exciting breakthroughs in urology in the past decade. Let's take a closer look. 3. Low-intensity shockwave therapy, LISWT. I'll never forget the look on my patient's face when I explained shockwave therapy to him. For the first time, he was in his late 60s, had recently gone through a divorce, and was feeling what so many men feel at that stage of life. Invisible, he said to me, "Doc, I'm not trying to be 20 again. I just want to feel like a man." He'd been struggling with diminished blood flow, less sensitivity, and what he described as a sense of disconnection from that part of his body when I introduced low-intensity shockwave therapy, or LIST. His eyebrows raised. "That sounds like science fiction," he joked. But what he didn't know, what most men don't know, is that this therapy has been quietly revolutionizing the way we approach erectile and penile tissue health in older men. It's not just real, it's remarkably effective, originally used to break up kidney stones. Shockwave therapy has evolved into something far more refined in urology. We use a much lower intensity, gentle acoustic pulses delivered to the penile tissue. These sound waves stimulate angiogenesis, which is the formation of new blood vessels, and they help reactivate dormant tissue by increasing nitric oxide production and nerve sensitivity. Simply put, LSWT helps the body heal itself from the inside out for men in their 60s and 70s. This is a game-changer. One of the biggest challenges with aging isn't just size, it's blood flow without healthy circulation. Even the best stretching or traction routine can feel like an uphill battle. But when you improve blood flow, everything else becomes easier. Firmness improves sensitivity, returns, and the tissue becomes more responsive to growth techniques. Some men even report spontaneous morning erections, returning for the first time in years. A powerful emotional marker of physical renewal treatments are simple. Most sessions last 15 to 20 minutes, done once or twice a week over the course of 6 to 12 weeks. There's no pain, no downtime, and no surgery. It's one of the few procedures in modern medicine that feels as good emotionally as it does physically. You sit back, relax, and let the technology do what your body has forgotten how to do on its own. I've seen men weep in my office after finishing their final session, not because of the treatment itself, but because of what it meant. Return to self, a return to intimacy, a return to possibility. For so long, they thought this part of their life was over, but it wasn't. It was simply waiting for the right kind of care. And while LIST is an extraordinary tool for restoring function and stimulating growth, there's another critical piece we haven't talked about yet. Something that fuels every system in your body, from energy to mood to sexual health. It's a powerful internal switch that begins to flicker as we age, often unnoticed. But if you know how to turn it back on, it can dramatically change how your body responds, not just in the bedroom, but in every area of your health. Let's talk about what drives it: your hormones. If you're still with me and finding these insights valuable, go ahead and type 1 in the comments to let me know you're here and engaged. Now, let's keep moving forward with point number 4, optimizing testosterone levels. Naturally, I've had hundreds of conversations with older men who come into my office not complaining about size or performance at first, but saying something like, "I just don't feel like myself anymore." They talk about waking up tired, feeling less motivated, less sharp, less connected, both emotionally and physically, to tease to their own lives. And one of the first things I look at in those cases is testosterone. Testosterone isn't just a sex hormone. It's a fuel source. It affects everything from muscle tone to mood memory to metabolism, and yes, to the health and function of penile tissue. After age 30, men lose about 1% of their testosterone levels each year. By the time you're in your 60s or 70s, that decline can be steep and its effects subtle, until suddenly, they're not. One of my patients, a 74-year-old retired engineer, came in with concerns about penile shrinkage, low libido, and fatigue. He didn't want medication. He wanted to know if his body still had the capacity to produce what it once did. The answer, in many cases, yes. The body doesn't stop making testosterone, it just gets less efficient. But with the right lifestyle shifts, you can reactivate that natural system and begin to feel alive again in a way that's hard to describe until you've lived it. We started with strength training, just light weights 3 times a week. Then we cleaned up his diet, cut down processed sugar, and added in zinc and vitamin D3. We made sure he was sleeping a full 7 to 8 hours and introduced short bursts of sunlight exposure every morning within 8 weeks. His blood work showed a 25% increase in free testosterone, but more importantly, his face looked different. He was standing taller, he had energy in his voice again, and yes, he noticed changes below the belt too. Increased fullness, stronger morning erections, and more sensation during intimacy when your hormones are balanced. Your body becomes far more responsive to any technique you use, whether it's traction stretching or other therapies. Testosterone primes the system. There's an emotional component to all this. Too many men feel shame around testosterone decline, as if it's something they did wrong, too much stress, too little exercise, bad habits from years ago. But aging isn't a failure, it's a shift, and with the right strategy, you can shift back. You can reclaim not just what you've lost, but often discover a version of yourself you didn't know was still there. Of course, some men will benefit from medical testosterone replacement therapy, and that's a discussion worth having with your doctor. But in my experience, most men can unlock noticeable improvement naturally without medication, as long as they're willing to show up for themselves with a little consistency and belief that change is still possible. But now that we've addressed hormones, the internal engine, it's time to explore something that often gets overlooked. The muscles that control what happens when blood fills the penis. These are the same muscles you've likely never trained, but they hold the power to strengthen erections, increase stamina, and support visible length. And the best part, you already use them every day. You just haven't learned how to control them. Let me show you how 5 pelvic floor muscle training, cool for men. I remember the moment clearly. I was speaking with a gentleman in his late 60s who had just undergone prostate surgery. He sat across from me quiet. At first, then finally said, "I didn't realize how much I depended on muscles I never even knew I had." He wasn't just referring to physical recovery, he was talking about something deeper. His identity, his sense of control. He felt like he had lost something but didn't quite know what it was. That conversation stayed with me because it reminded me how many men are unaware of the role their pelvic floor muscles play in sexual health, urinary control, and yes, even penile length and function. These muscles, the ones that form the base of your core, are often forgotten. We don't see them. We don't flex them at the gym, and most of us never learn how to isolate or strengthen them. But they're absolutely essential. They act like a support system for the penis, helping to control blood flow, maintain erections, and increase the rigidity and visible length of the shaft during arousal. As we age, these muscles naturally weaken, especially if we've had surgery, been sedentary, or dealt with long-term stress or poor posture. Weak pelvic floor muscles can cause erectile difficulties, premature ejaculation, and even that frustrating turtling effect, where the penis seems to retract or shorten when flaccid. But here's the good news: you can strengthen them at any age. And the results can be both dramatic and empowering. Kegels for men. Yes, they're not just for women, are simple but powerful exercises designed to activate and build the pelvic floor. The technique starts by locating the right muscles. The easiest way to find them is during urination. Try stopping your stream midway. The muscles you use to do that are the same ones. We want to train. Once you found them, you can begin practicing contractions. Squeeze and hold for 5 seconds. Then relax for 5 seconds. Do 10 to 15 reps a few times a day. It may seem small at first, almost too subtle, but over the weeks you'll begin to feel more internal strength, better control during intimacy, and improved fullness in erections. Some men even report a noticeable difference in the way their penis hangs when flaccid, because a stronger pelvic floor helps hold it forward instead of letting it retreat. It's not just about adding size, it's about reclaiming presence. One of my patients, a 70-year-old widower, began doing Kegels twice a day. After 3 months, he came in for a routine checkup and told me something that made us both smile. "I feel like I've got my body back. I stand taller. I feel stronger down there. It's like I've got this quiet power no one else can see, but I can feel it." That's the beauty of pelvic floor training. It's invisible, but its impact is deeply felt, and just when you think you've done all you can with muscle blood flow and hormones, there's another layer to this one that most men overlook. It doesn't start in your body. It starts in your habits, in your daily choices, in the way you sleep, eat, move, and breathe. What if I told you that unlocking just one of these overlooked factors could not only improve your health, but also uncover up to an inch of visible length that's been hiding in plain sight? Let's take a closer look. 6 lifestyle factors: sleep, weight, and cardiovascular health. I once had a patient in his early 60s who came in frustrated. "Doc, I've tried everything, stretching, diet. Even those traction devices you recommended. I feel a little better, but nothing seems to change much in size." He was doing all the right things on paper, but something wasn't adding up. So I asked him a simple question. "How are you sleeping?" He paused terribly. He admitted, "I'm lucky if I get 5 hours a night." That one answer opened up a conversation we should be having more often about how your lifestyle is either helping or silently undoing all your progress. Sleep, weight, cardiovascular health. These might not sound as exciting as new therapies or advanced techniques, but they form the very foundation of your ability to respond to any male enhancement method. I've seen men plateau, not because the method failed, but because their bodies were simply too exhausted, inflamed, or burdened to heal, regenerate, or respond. Let's start with sleep. Most men don't realize that your body produces the majority of its growth hormone and testosterone during deep sleep. These hormones are essential for maintaining penile tissue health, sexual function, and natural energy. Without quality rest, your hormone levels drop, blood vessels stiffen, and your recovery from stretching or traction becomes compromised. One patient, a retired firefighter, started prioritizing 7 to 8 hours of uninterrupted sleep each night. Within a month, he reported firmer erections and more noticeable gains from the same traction device he'd been using unsuccessfully before. That's not a coincidence, that's biology. Then there's weight. As men age, it's common to gain fat around the lower abdomen, but what most don't know is that this fat pad directly covers the base of the penis, making it appear shorter. You might have an inch or more of length that's not gone, just hidden. Losing 10 to 20 lbs can often reveal that length, along with dramatically improving cardiovascular health and self-esteem. I've had men tell me that a simple reduction in waistline changed not just how they looked naked, but how they felt as men. They moved differently. They stood taller. They reconnected with a sense of pride they hadn't felt in years. And finally, cardiovascular health. The cornerstone of sexual performance. Erections are a vascular event. They rely entirely on healthy blood flow. If your arteries are clogged, stiff, or inflamed, it doesn't matter how much you stretch or train your pelvic muscles, your results will be limited. Walking just 30 minutes a day, eating more whole foods, and quitting smoking or excess alcohol can bring life back to your circulation. One man in his late 60s told me, "I didn't think walking a few miles a day would do anything, but 3 months in, I feel like a new man, clearer mind, better energy, and my wife's noticed too." These changes may seem small, but when they add up, they create an environment where your body is finally ready to grow, to heal, to respond, and perhaps most importantly, to believe again. But all the science in the world can't prepare you for the final and maybe most important piece of the puzzle, because this last factor doesn't live in your body at all. It lives in your mindset, in your relationships, and in the way you see yourself as a man. It's something no pill or device can give you. But once you tap into it, everything else begins to shift. Let me share what I've learned. 7. Psychological empowerment and partner communication. A man in his 70s once told me something I'll never forget. He said, "Dr. Kara, I could handle the physical changes, the wrinkles, the slowing down, even the gray hair. But the hardest part was what it did to how I saw myself. I stopped feeling like a man that quiet." Confession struck me deeply, because in all my years as a men's health specialist, I've seen this truth repeat itself time and time again. What's happening in your mind and in your heart plays just as critical a role in your sexual health as anything happening in your body. That's why this final method, psychological empowerment and partner communication, may be the most transformative of all the men who make the most progress. The ones who feel truly fulfilled aren't just doing the exercises or using the devices, they're reconnecting to who they are and to the people they love. They begin to shift their narrative from "something's wrong with me" to "I'm still in control of my story" for many men over 60. This part of life can feel isolating. You may have experienced loss change or the subtle fading of intimacy. The silence that often surrounds men's sexual health only makes that worse. But when you start to talk to name what you're feeling with your partner, a close friend, or even a professional, something powerful happens. You take shame out of the shadows and replace it with intention, with clarity, with hope. One of my patients, a man who had been married for 35 years, came in struggling with both confidence and communication. His words were clipped, and he carried himself with a kind of quiet resignation. But after starting some of the therapies we've talked about, I encouraged him to sit down with his wife and simply share where he was at, what he was trying to improve, and why he came back a month later with tears in his eyes. "Doc, I thought she'd be embarrassed or disappointed, but she looked at me and said, 'Thank you for letting me in.'" It was the first time in years we really talked about us. That kind of honesty is healing. It doesn't just strengthen relationships, it strengthens identity. Because when you open up, you create a space where growth becomes emotional, not just physical. You shift from performing to connecting, from hiding to healing. This is what I call the internal traction, the mental and emotional force that pulls you forward when discipline alone starts to wear thin. It reminds you that your health journey is not just about inches or appearance. It's about confidence, closeness, and the freedom to live without the weight of silence. And here's the secret. Most men never hear when you empower your mind and your heart. Your body follows you. Walk differently. You breathe differently. Your results amplify, not because you tried harder, but because you started to believe again. Now we've covered a lot, 7 methods each, backed by science and shaped by real experiences. But before we close, I want to leave you with something that ties it all together. Something I've learned after decades of walking beside men on this very journey, because if you think this is only about growth, you might be missing the bigger picture. Let's talk about what it all truly means and where to go from here. Conclusion: a few years ago, a man in his late 60s sat quietly across from me during a follow-up visit. He had come to me months earlier feeling defeated, disconnected from his body, uncertain about his future, and unsure if there was any point in trying to change. But this time there was something different in his eyes. He smiled, sat up a little straighter, and said, "I never thought I'd get here. I'm not 20 again. But I feel strong. I feel like myself. That, right. There is why I do this work, not just for results on paper, but for the moments when a man reclaims something he thought he had lost for good over the course of our time together. Here, we've walked through 7 powerful and science-backed ways to increase penile length, not through shortcuts or surgery, but through real lasting changes rooted in biology, behavior, and belief. You've learned about the value of manual stretching, where consistency and gentle effort lay the foundation for growth. You've discovered how traction devices, when used with patience, can produce measurable client-tal gains in length, even in your 60s and beyond. We talked about low-intensity shockwave therapy, a breakthrough treatment that stimulates blood flow and helps regenerate tissue, restoring sensitivity and firmness in ways many thought impossible. And we took a deeper look at testosterone, the quiet engine that drives not only your sexual health, but your confidence, energy, and ability to respond to every other method effectively. Through pelvic floor training, you learned that strength isn't always mighty visible, that the quiet internal muscles you rarely think about can hold the key to better erections, control, and increased presence. Then we turn to the foundation of your body's recovery and performance: sleep, weight, and heart health. These aren't side issues, they're critical. They make all the difference between progress and stagnation. And finally, we explored the emotional core, psychological empowerment, and partner communication, because without a shift in how you see yourself, without support, without connection, it becomes easy to forget why you started this journey in the first place. Here's